Hello, everyone. Here is an update on my hormone replacement therapy, estradiol. She is Tamika and Tamika is she. Hey, she is Tamika and Tamika is she. Hey, she is Tamika and Tamika is me. Hello, gorgeous. Welcome and welcome back to my channel. So let's go ahead and get right into my hormone replacement therapy. I am now 46 on perimenopause. The symptoms, the updates. If you have not checked out my previous two videos that I talked about on my perimenopause journey, make sure you check those two links down below. I will have them pinned in the comment section. But this video was highly requested by my girl Bellflower, okay, on the hormone replacement therapy for 8 months now. So why did I decide to start my HRT? Because I got sick and tired of my own self. My mood swings is what I got sick and tired of. And I got also tired of the night sweats, waking up in a pool of water, basically. And my husband, he got sick and tired of it. But that is the reason why I decided to go ahead and do it. Now, listen, I am 46 and I am in perimenopause. However, I started noticing these two symptoms, really the night sweats, at the age of 35 years old. At the time, my nurse practitioner, she didn't really take what I was saying serious. And it was kind of heartbreaking because I could have avoided this prolong of night sweats, 10 years of going through this and just thinking that I had to deal with it. So finally, I was like, I need to do something about it. And it wasn't until I heard, of course, B Mel B talking about perimenopause, her and Perfectly Pamela. They were on Downsizing Divas live, and they were, discussing, the things that the women go through. And I couldn't tell you that those ladies really helped me, those ladies helped me a whole lot and really understand that, you know what, girl, you are in perimenopause and you are like 10 years behind on getting the help that you need, and you no longer have to suffer anymore. So I quickly text Mel and I was like, hey, what is the verbiage that I need to say? Because I wanted to make sure that when I did switch my doctor, I was still at the same location. I wanted to make sure that I knew exactly what I was talking about, and I wanted to give them the correct verbiage that I need to get my hormones checked. And the verbiage that you would need is to ask for is oh good Lord, a full blood panel. You need to ask that to your doctor so that they understand and that you know what you're talking about. So long story short, when I said, hey, I want to get my blood panel checked because I am having XYZ symptoms and I believe I am in perimenopause. And she was like, okay, so we did replace your IUD last year, so that's good. And are you having a cycle? No. Well, that's working right. And it's like the vibe that I was getting from her was, I'm not sure if you're on perimenopause. I just think that you're not having a cycle is the result of the IUD. But nevertheless, because I knew what I was talking about, she went on ahead and was like, you know what, let's go ahead and get the orders done. And I want you to write down the symptoms of things that you're having. And when the test results come back, we will go over them together. Long story short, the test results came back that I was perimenopause. She was shocked. She could not believe that I was in perimenopause. And at the time, I was 45 years old. This was 8 months ago. Changes that I noticed was that my mood quickly went from like a low level of 1 all the way up until maybe around a 7 or 8. So I was no longer rah, 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 rah. I'm more like now, arf, 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 arf. So I will bark a little bit, but I'm not as bad as I was before. The night sweats has calmed down significantly. And that's one of the things that I am so surprised about this HRT is that the night sweats, dramatic. I didn't have to wait a whole week to start seeing results. I started seeing changes, like my body just feeling like a relief each day by day. That's what I started to feel. And another one that another side effect, a symptom. So there is this one symptom that I was having prior to taking the HRT, is that it felt like pins and needles, when my husband and I do the thing, okay? When I took that HRT, it's raining. Yes. No pins and needles. It just feels very nice and pleasant. I am no longer, no, I don't want it no more. Get away from me. Are you serious? Like, and the intimacy with my husband, it was just like, I don't feel like it. And because I know what I'm about to experience, the dryness and everything, but now I don't have that problem. It is gone. I noticed that within maybe a week, I would say everything was fine. Everything was, squish, squish. There are some other side effects that comes with the HRT, is that there is a possible weight gain. And I am surprised that I did not gain a whole lot of unwanted weight. And, to me, I feel like I gained weight in the right places. Like I finally got some curves to my body now. Maybe when I took the HRT, it's like it gave me the curves that I need. And you would think strength training will give you the curves. It will give you the curves, but ain't nothing like a boost of estrogen to help a sister out with them hips and thighs, okay? Maybe wondering, what is this patch that she keeps talking about? Well, you can take a patch or you can take a pill. I'm not on a pill, but I'm on a patch. So I have estradiol, and this is the highest dose. My estrogen levels was as low as a woman in their 50s. So she gave me the highest dose, which is 0.1, milligrams. And you take this twice a week. Inside the box, just in case you've never seen this before, you get to pick a schedule, okay? So I have Wednesday and Sunday, and I just follow that schedule every single week. Another one that I did experience was Dottie's. Dottie's is a generic brand. So how did I come about getting Dottie's? Well, my doctor never put me on a 90-day supply. So after two refills of this, the third one, they gave me Dottie's. And that has been in a repeat cycle for me. So honestly, like Dottie's better. Now, one of the unpleasant side effects that I do not like about the patch, regardless if it's the estradiol or the Dottie's, is that not often, but sometimes I will get like a little itchy sensation at the site of where I put the patch. So you can put the patch on your stomach, you can put the patch on your upper buttocks, not on your butt, but just above. I just rotate the sections. I just rotate it from here to here, or I go a little bit down, or I go a little bit up. Skin looks faded, then it's fine. But if it looks dark, then that means that I've kind of got like a reaction, and it like itches a lot at the site. Now you can replace it, put it right back on your skin. It is very adhesive, so you can get in the shower, you can bathe, and it will not come off. But if it does, tend to peel up a little bit, just gently place it back on and it will restick. I never had where I had to like take it off and I couldn't reuse it. Never had that issue. Everyone reacts to the HRT differently, so I would highly suggest that you talk to your healthcare team and let them know about the symptoms and side effects that you are having, as each one of us is going to be different. You're going to have a different story from mine. I don't want to open it up, but it is kind of like a little mini rectangle. That's where it is. It's right there. Now, Dottie's is a circle. Forever grateful for even having this HRT, and I will not come up off of it until my doctor says, hey, you're good. We don't need to do any more HRTs, because I don't know what's going to happen when I hit menopause. Like, I don't know. It's scary. It's a little scary. Every woman that I've heard that started the HRT has had a great experience. Make sure you give this video a thumbs up. And if you are new to the channel, honey, please subscribe and give this video a thumbs up. And I will chat with you later. Goodbye, gorgeous.